Propofol expert Dr. Paul White. Remember, this is a case could come down to a battle of the experts. The science could decide it, so the jury has to pay close attention to this. The defense wants to discount Dr. Dr. Shafer, the prosecution's expert, in his theory that there was an IV drip, and that's how they got to Michael Jackson's levels of propofol in his blood. Let's go back to court.
Well, we'll move it up in just a minute, if you don't mind. This is called the continuum of depth of sedation, which I've been referring to quite often, from minimal sedation or anxiolysis. What is anxiolysis? It's just reduction in anxiety. It's a short term for that. And it shows moderate sedation, analgesia, which is commonly referred to as conscious sedation, and then deep sedation, which I've referred to where patients are essentially sleeping but can be aroused with vigorous stimulation, and finally general anesthesia, where they're not only sleeping but you cannot arouse them with reasonable stimulation or vigorous stimulation. And this were the definitions that were approved by the American Society of Anesthesiologists House of Delegates in October 2004 at our annual meeting, and subsequently amended in October 2009. So they're fairly current and represent what this organization, which is the organization that speaks for all of us anesthesiologists. And I think it's a very appropriate representation of the kind of physiologic responses that you would expect to see at the various levels of sedation. Now you can move it up. I'm sorry.
I've moved it up so it shows most of it. Could you explain what it indicates?
Well, what it looks at is the relationship between the level of sedation, or as I frequently refer to, depth of sedation, and various physiologic changes in the brain response, that is responsiveness to verbal commands or other stimulation, tactile or otherwise. The airway, whether your airway is at risk to becoming obstructed. I think Dr. Shafer showed some examples where the tongue can fall back and cause obstruction. So maintaining what we call a patent airway, which means air can easily go in and out of the mouth. Spontaneous ventilation, this is just your normal respirations. And whether they would be expected to be affected. And finally, cardiovascular function, which is your blood pressure, your heart rate, and other indices like cardiac output, which is not really measured. But we look at how they would, which of these various physiologic parameters would be expected to be affected at each of these levels. And I think the point you're trying to make, and I think the important point in this case, is that minimal sedation, as was provided by Dr. Murray to Mr. Jackson, would expect to result in a normal response to verbal stimulation, would not have an effect on the airway, would not affect spontaneous ventilation or cardiovascular function. So in essence, it would produce a reduction.